Hi, today we are going to talk about our care plan on osteoporosis and depression. This is our team, and we are going to talk about introduction, definition, scope of practice, risk factors, management, significance, and some recommendation on osteoporosis and depression. Going through our case study, Mr. Smith is an 88-year-old male. As a social worker, we are attached to a geriatric outreach team, and we have been asked by our lean home and community care physiotherapist to assist an 88-year-old gentleman with a decreased appetite and apathy. He lives independently, but he has recently lost his wife 6 months ago. Mr. Smith has withdrawn from his twice weekly exercise program since her death, and they also expressed concern about his appetite has decreased markedly. And going through his past medical history, he has been diagnosed with osteoporosis now, following a risk factor since 10 years ago. He has been taking medications such as calcium, vitamin D, alendronate. He is doing well with his activities of daily living and instrumental activities of daily living. While doing the preliminary assessment, it has seen that his muscle is wasting. He is wearing loose fitting clothes, and his dentures is not properly fitting. He appears fatigued as well as apathetic. Some of our team has done his GDS scale, and he has given most of the answers like I don't know. Um, his weight is normal, and yeah, he has done well with his range of motion, but his quadricep strength has reduced, and he is not able to stand without the use of his hand from a seated position. He walks slow, and his home is not clean, and he is not taking proper diet. So while going through his condition, it has seen that he is his depression is going severe. Um, moving towards his disease and moving towards the disease and the condition, osteoporosis is widely recognized as a public health issue and is dubbed the silent disease of the century. On the other hand, depression is the most frequent mental condition and the most common mood disorder, and it has a multifactorial etiology. This prevalent condition affects 15% of the population at least once in their lives, according to the CASIF research.
Now, moving towards the disease condition that is osteoporosis. It is a condition that affects the bones, makes it porous and easy to break. So, as previously mentioned, it is often called as the silent killer because it has no symptoms. The patient is usually unaware of their bone loss until they experience a fracture. Most common sites, like fracture sites that is related to osteoporosis, are hips and wrist. Now moving towards the other disease condition, that is depression. It is a mental illness which is usually characterized by the persistent sense of sadness, and there is loss of interest in any of the activities. It can also affect the person's feeling, thinking, and behavior, and can also lead to a variety of mental and physical difficulties. It is also known as major depressive disorder or clinical depression. Now moving towards the scope of practice, Uh, 2.3 million Canadians are living with the condition of osteoporosis. At least 1 in 3 women and 1 in 5 men will break a bone due to osteoporosis in their lifetime. And a wrist fracture is the third most common fractures that is related to osteoporosis. Now, regarding the depression, around 9% of women and 3% of men who are older Canadians, they experience this disease condition. And both men and women who are depressed, they have shown that they have decreased bone mineral density, leading to the osteoporosis. Their study conducted by Kasvi et al. Found that nearly 87% of people with osteoporosis have mild to moderate depression. There, they found that there is a substantial relationship between depression and bone density. Individuals with osteoporosis score higher on the depression scale than the average individuals. Another study conducted by Kelly et al. Found that the osteoporosis, particularly the osteoporotic fracture, it may result in lower quality of life and can have detrimental effects on one's mental, physical, social, and financial well-being. So, in terms of psychological health, osteoporosis can result in depressive symptoms as well as anxiety that is brought on by the worries of falling or breaking bones. Osteoporotic fractures can result in lower self esteem and self image because of emotion of helplessness and loss of independence.
Mm. Numerous studies have shown a link between the use of antidepressant and osteoporotic fractures, and it has been hypothesized that depression may be an underestimated risk factor for osteoporosis. There are various risk factors of both osteoporosis and depression. The main factors that affects osteoporosis are the less intake of calcium and vitamin D, low intake of high quality proteins and inadequate poor sources of vitamin B12 and folic acid. Likewise, lack of sufficient amount of fruits and vegetables also leads to osteoporosis. The sedentary lifestyle, aging, white population, prolonged immobility, and increased morbidity further leads to osteoporosis. On the other hand, the depression risk factors are the social change, the impairment, such as Mr. Smith is having a dentures problem. His dentures are not fitting well, so it might lead him to depression, as well as the loss of his spouse and the environment change, physical illness such as osteoporosis, and his disturbed sleeping pattern are the main risk factors for the depression.
For the management, as a social worker, we will ask Mr. Smith for a referral to an interdisciplinary team to further assess and find better solutions to these concerns and help him with those difficulties. Since the loss of his wife, we are concerned with his lost interest in social activities and uh, the depression. First, in our team, we have the social worker who can do counseling and referral to a family doctor or psychologist to further assess the client's behavioral and emotional status after losing his wife. Another one is the psychiatrist who can assess and evaluate Mr. Smith whether he needs non-pharmacological or pharmacological needs for his depression. Since Mr. Smith lost weight, a dietitian can explain to Mr. Smith the bad habits of eating junk foods that sometimes affect his appetite and encourage him to incorporate healthy foods like vegetables and fruits. Also, a personal support worker can help him with his activities of daily living and instrumental activities of daily living like doing the grocery and preparing food for him. Additionally, a PSW can assist him in showering. Next, a physiotherapist can conduct a regular visit to assess and provide exercises, can encourage him also to return to his twice weekly exercise program in his community. Also, a physiotherapist can provide a range of motion exercises that focus on his quadriceps part to regain his strength and balance. An additional team will be a therapeutic recreation specialist who can further assess the lost interest in participating in the activities and can help the patient by doing the activities in his home. And also can encourage him to participate in any community program or register to a daycare program that offers physical exercises or a relaxation yoga. And next, we have the occupational therapist who can help him assess the home environment, what are the things needed and what is not. And for additional management, we will reintroduce the wheels on meals and provide more information on how the service work and he can order depending on his needs and wants to eat. This will be easier and more convenient for the client, especially since he is living independently. And another one, more time visit from his son and his and grandchildren for maybe 1 to 2 hours a day can be recommended to help relieve Mr. Smith of his loneliness after the loss of his wife. A collaboration with his son, if he is willing to bring his father to live with his family, this will give them more time with himself and his grandchildren wherein he enjoyed his time with them. And also we will encourage Mr. Smith to invite his friends to come over to his house once in a while for socialization by doing activities like live music, dancing, playing cards, or any activity that interests Mr. Smith. And lastly, we can ask or suggest to Mr. Smith if he has a church mate before, or if he is attending church, he can attend the church together with his friends or his son and grandchildren.
So there is a relationship between the osteoporosis and depression. The relationship between the two disease conditions can be explained by the fact that osteoporosis causes depression. However, it is controversial that whether depression causes osteoporosis or osteoporosis causes the depression. Uh, the study conducted by Penica has confirmed that the osteoporosis causes the depression. And the common risk factors for the both disease conditions include smoking, drinking alcohol, and decreased physical activity. In the case scenario, the fact that Mr. Smith had osteoporosis for 10 years made him prone to depression. Also, the death of his wife that took place 6 months ago worsened his depression. And depression has withdrawn him from various activities like skipping exercise classes, finding it useless to cook and eat him alone, and decreased concern about his own hygiene. Therefore, it is important to monitor Mr. Smith for the worsening of osteoporosis and depression.
So for the recommendation, geriatrician, check his physical and mental health given his weight loss, decreased appetite, and lack of interest. Mr. Smith's medical issue, including osteoporosis, can be thoroughly examined by the geriatrician, who can also help treat his sleep challenges, decreased appetite, and other physical complaints. Psychiatrist, as he has decreased in his interest to do things, he might need help from psychologists to do a thorough assessment and management of his depression. The psychiatrist might recommend him medication therapy to manage his depression. Dietitian, considering Mr. Smith laser appetite, reduced intake of food, and the high number of convenience food in his home, a referral to a nutritionist is advised to assess his nutritional need and give counseling on appropriate eating habits. The nutritionist can help him to manage his osteoporosis and ensure he takes vitamin D and calcium, as he lacks motivation to cook food for himself and has a muscle wasting and clothes are loose fitting for him. For the other recommendation, it is cleaning service. Mr. Smith's home environment may be the cause for his physical and emotional decline. To create a clean and safe living environment, a referral to a cleaning agency or assistance in organizing a cleaning routine with family is recommended, as there were some foods on the countertop. Home care agency. Mr. Smith decreased energy and ability to carry out his ideal, so that he may be benefit from home care services. A referral to her home care services is suggested for support with routine tasks such as cleanliness and meal preparation and other activities of daily living. Grief counselor. Mr. Smith is dealing with the death of his wife, which has resulted in his lack of interest and feeling of hopelessness. A referral to a grief counselor is suggested to assist him to process his grief while managing his emotional need, as he has not attended weekly exercise classes. So now also we can Mr. Smith admires his family and spends time with them to give social support and lessen his sense of isolation. It is suggested for he engages in regular event with families and friends. So now for further, if given the consent by Mr. Smith, we as we are a social worker, we can work with interdisciplinary team member to conduct a care conference. And also if given consent by Mr. Smith, we will be doing the follow-up visit within the next 2-week period. So further, next slide. Yeah, these are our references. Thank you.